Gina, can you hear me?
Yes, I hear you.
Did you notice
Yeah, I
Okay.
just
You adjusted the word? Okay. I hope he will adjust it as well. I sent it to Ibrahim as well. Why my computer is doing this?
You went already.
Oh, we are.
Recording in progress.
Welcome to this open forum. Marijuana was recently legalized in many states. You may be actually in Canada, which was already legalizing marijuana for a while, or you may be one of the states that already had accepted legalization. As a Christian channel, as a Coptic Medical Association also of North America, we had a responsibility towards our members and our families to talk about not everything legal is always immoral, is always moral. And this is one of the things that we will be discussing today. While it may be legal, is it moral? I am very honored to have two speakers. Both of them are very well known in their careers, and I'll introduce them one by one. Before I begin with Dr. Mina Makarios, I just want to say that marijuana may not be written in the Bible, but what is written in the Bible, everything is lawful, but not everything is edifying. Everything is lawful as long as it does not empower or overpower me. And this is one of the things that this verse will apply to. While it could be lawful, that doesn't mean it's and for overpower. With that said, I would like to introduce Dr. Mina Makarios. Mina Makarios is a friend, a colleague, and I consider him sometimes a son. Dr. Mina Makarios is a lung specialist. We call him pulmonologist. He's also a critical care specialist in New York, and he's an assistant professor of those diseases in Hofstra University. The plan will be as follows. Dr. Mina Makarios will state some of the physical issues related to use or abuse of this recently legalized habit. After this, he will take your questions, which some of them already came through the forum, and you probably see it in your social media. We'll be happy to take your questions to Dr. Mina at 7:30 or about. Star of this show and guest of honor, Dr. Martina Moore. Dr. Mina Makarios, thank you very much for joining. I would like you to please go ahead and discuss your part.
Thank you, Dr. Hani Hashamalla. Thank you, everyone, for having us. It's my pleasure to be with you all tonight and to talk about, I will start talking about the medical effects of marijuana on the body. And Dr. Moore will talk to us about the psychiatric and mental health perspectives. I will just go ahead and share my screen here. 1 second. All right, so you should start to see my screen. And I will start with the slideshow. Okay, so can you all see my screen? Okay, perfect. All right, so the effects of marijuana on the body. I want to just start by giving a little background. I know you will see me use the words marijuana or cannabis interchangeably throughout the talk, and that's because they are used interchangeably, and also we will talk about what marijuana is briefly here. It is the third most commonly used psychoactive substance worldwide behind tobacco and alcohol. And the properties of marijuana that are appealing to those who use it is, first, it gives a strong high or a euphoria. And secondly, it has sedation properties or relaxation. And thirdly, it has some analgesia or pain control. The psychoactive altering chemical in marijuana or cannabis is THC. THC is tetrahydrocannabinol, or delta-9 THC. And this is the drug this is the chemical in the marijuana that causes many of the side effects that we will be discussing today. Very interestingly, when I was reviewing this, I was reading on the data regarding marijuana use in the United States, and it's estimated at 46%. 46% of Americans at some time in their life will use marijuana. But most commonly, the use is in young adults, ages 18 through 25, and males use more than females. So quickly, how is marijuana used? And this will have implications in terms of who is affected by marijuana use. And you'll see here that the most common form of marijuana use is smoking, whether it's a joint, which is the paper rolling the marijuana, or a pipe or a bong. These are different ways of smoking marijuana. Second most commonly are the edibles. And then thirdly, in more recent years, the development of vaping marijuana. Initially, this was kind of developed as vaping nicotine, and then they developed these elaborate pens, and now people are vaping marijuana, and we'll talk about the effects of that as well. So I just want to quickly explain to you from a medical perspective how this affects, you can see how this affects the human body. And if you look here, if you look here closely, at the top here, whenever an individual smokes marijuana or vapes marijuana, the marijuana will go through the mouth, it'll travel, it's inhaled, so it'll go down the windpipe, which is known as the trachea. It'll enter into the lungs, so there are two lungs, the left and the right. It'll enter on both sides. And all of us in our lungs, we have airways, and at the end of the airways are little air sacs called alveoli. And just like any inhaled medication that we give, as a pulmonologist, we give a lot of inhaled medications. These medications or these drugs will go all the way down into the little air sacs. And at the tiny air sacs, there's what's called the blood-gas barrier, the interface, the connection between the air sacs and the blood vessels. And marijuana will enter, the THC, the psychoactive chemical in marijuana, will enter into the bloodstream at that interface between the air sacs and the blood vessels. And then you'll notice that the time it takes from the person smoking marijuana to feel the effects is very fast, because inhalation route for medication is very quick. And so within seconds, the marijuana chemical has reached the brain. And you'll notice that, skin may get, because of the blood flow to the skin, the user may have a warm feeling. Vessels will pop up in the eyes, when they get the bloodshot eyes or the red eyes. And then, of course, because the heart is going to be pumping this blood that now has the marijuana chemical, it will go to all the body. But most importantly, we'll talk about the effects on the lungs, on the heart, and on the brain. And when it goes into the brain, it affects many different parts of the brain. We'll talk about this later, but especially the one area that gets affected is the hypothalamus, and this area will affect hunger, so the user will feel hungry. Another area is on the side here in the temporal lobe is something called the hippocampus, and this affects memory, so short-term memory may be affected. The cerebellum may be affected, and this can affect hand-eye coordination, and the occipital lobe will be affected. This will affect visual, it can cause visual disturbances. So all parts of the brain are actually affected when marijuana is inhaled. And I put this slide in here just to explain that although the most common use of marijuana is through smoking or vaping, up to 60% of users will use it as smoke or vaping, there are a significant percentage of people that will use it as oral edibles. And one thing that's important to note is that when you take the marijuana edibles, it will enter into the bloodstream, although it occurs at a slower pace. However, and very importantly, there may be higher peaks in the THC, the psychoactive drug levels in the body may be higher with oral administration. And then very importantly here, I put this here because those of us who are in the medical field, we always talk about something called the blood-brain barrier. And not many drugs or chemicals or medications that we give can cross the blood-brain barrier, but marijuana very easily crosses the blood-brain barrier, and that's the barrier that protects the brain in the blood. Marijuana crosses that and causes these effects on the body. I won't concentrate too much on what's called cannabis use disorder, because Dr. Moore will be speaking in depth about this. But just to give a little introduction, especially since I always believe that the mind and the body are very interconnected, and it would be wrong for me to discuss the physical effects without briefly addressing the psychological or the psychiatric effects of marijuana. But cannabis use disorder is actually a disorder when an individual meets two or more of these criteria. So for example, consuming larger amounts of marijuana than intended, having a high tolerance, feeling a need or a desire to cut back, spending too much time trying to obtain marijuana, having strong cravings to use it, unable to do daily activities or go to school or be able to concentrate, for example, in class. It affects your social life, not doing social activities because you need to smoke, etc. And then one of the things that's important, and it affects on a psychiatric level, but also on a physical level, is what are the risk factors for developing cannabis use and disorder? And these include frequency of use, duration of use. And I think it's important to understand these two concepts, because the frequency of use and the duration of use will also affect the medical complications of long-term marijuana use. I do want to briefly talk about the fact that there is a clear relationship between marijuana use and psychiatric illnesses. And one of the biggest debates in the medical literature is, does marijuana cause the psychiatric illness, or is a psychiatric illness cause a person to start smoking? What is the causal effect? And the other, then the question becomes, are they related because just by chance, or are there risk factors common to both? And I think it's very important to talk about this, and I'm sure Dr. Moore will talk about this, but there are many psychiatric illnesses that are very clearly related to marijuana. These include depression, bipolar disorder, schizophrenia, and psychosis. And this last one, schizophrenia or psychosis, which is, when someone has hallucinations, like auditory or hearing voices or seeing things or having delusions, these are all part of the schizophrenia spectrum. There has been in the medical literature a clear association between a psychotic event, these delusions or hallucinations that can occur secondary to schizophrenia, secondary to marijuana use. And it has been shown in many studies that there appears to be a causality between marijuana smoking and the development of schizophrenia or psychosis later in life. And I'm sure Dr. Moore will go deeper into this. And then, of course, from a medical perspective, patients or people who use marijuana are more likely to use other drugs that can have significant damaging effects on the body. And these include alcohol, tobacco, opioids, and among other drugs, including cocaine, sedatives, etc. But I want to talk here about the medical effects of marijuana, and I will spend some time here talking especially about the lungs. I have a bias because I'm a pulmonologist, so I will spend some more time on lung damage from smoking marijuana. Smoking marijuana chronically, one point I want to note is, or emphasize, is that most people who smoke marijuana chronically will also likely smoke tobacco. And whether it's the marijuana leading to tobacco, or it's just a culture of smoking marijuana, so you want to smoke anything that comes in front of you, like cigarettes as well, it's unclear. However, we do know that we know about all the consequences of smoking cigarettes, but we do know that smoking marijuana, for example, will cause much more severe lung damage to a person than somebody who just smokes cigarettes, as an example. But there are many other effects of smoking marijuana on the lungs. And I put them here on the slide. You can see there's patients who smoke marijuana chronically can develop a chronic cough. They can develop a lot of sputum. They can develop difficulty breathing over time. I have a lot of patients who have underlying asthma, and it's clear to me that their asthma is frequently exacerbated by smoking marijuana. And when I say exacerbated, I mean that they have an underlying problem in their lungs, which is asthma, where the airways are very narrowed or inflamed, and you hear the wheezing. And then when they smoke marijuana, that gets worse. Marijuana itself can cause what's called emphysema, and I'll show you pictures of that in a minute. Marijuana has been linked to, very clearly linked to lung cancer, and has been thought to be associated to other cancers such as head and neck or oral cancer, but very clearly linked to lung cancer for sure. And I have seen several cases in my career as a pulmonologist of what's called a pneumothorax, or a lung collapse from smoking marijuana. So let me give you some pictures and try to explain to you some of these effects of marijuana on the lungs. This is a patient who came in. This is what's called a chest X-ray, and you can see here it's kind of when you look at it, what is on the left side is actually the right lung, and what's on the right side is actually the left lung, and you can see here the heart in the middle. And for those of you in the medical field, you'll notice a very clear point of right here. You see this line, and this is what's called a pneumothorax. And this patient had a spontaneous pneumothorax, or collapse of that right lung, because of chronic marijuana use causing bullous emphysema in his lungs. And what is emphysema? So I'm going to show you a picture here of someone's lungs. This is emphysema. This is two different individuals who smoked marijuana chronically, who developed significant emphysema in their lungs. And actually, this one on the left only smoked marijuana. The one on the right also smoked cigarettes. But you'll notice here, none of this is normal lung. And I'm going to show you actually an image of normal lungs soon. But you could see on this CAT scan that if this is what we would call, it would be what the lung should look like. You see all these bullous changes in the lungs. All these these are large dilated sacs of air that are not actually allowing the person to breathe. The actual lung is very squished, and the lung itself is very emphysematous. The air sacs are destroyed, and this person had severe difficulty breathing. His oxygen levels were very low. His carbon dioxide level was very high, and we actually had to transfer him from our hospital to a different hospital for a lung transplantation evaluation. He was only, I don't remember the exact age, but he was in his late 20s from what I remember. Here's another patient on the right side. This patient also has the paraseptal emphysema. You see all these areas where there's air, where they're not supposed to be. Air is only supposed to be inside the lungs. And the emphysema here causes, the marijuana here causes this emphysema, or destruction of the air sacs. And the air sacs become completely dilated and become inefficient at exchanging oxygen and carbon dioxide, which is the main function of the lungs. I want to briefly focus on the recent vaping crisis that we have seen, and I'll talk just 2 minutes on this. About 2 years ago, in the summer of 2019, we saw a crazy amount of cases in our hospitals of patients who developed severe lung injury because they were vaping. And most of the time, it's because they were vaping THC, or marijuana. It's usually an oil. They put it in a vape pen, and you inhale, and it causes a lot of smoke. It's the vaporizing. A lot of these people do, vaporizing contests because they like the smoke. But the oil is inhaled at very high temperatures, and it causes an injury to the lung by both thermal injury, or heat energy, or heat injury to the lungs, but also a chemical energy from the liquid oil that is used to inhale the marijuana. And these patients came to us, and at the time it was very new because we had never seen this before, and we actually published a case series a couple of years ago about this because of how interesting and how new it was. But these patients presented to us with fevers. They had a significant cough. They couldn't breathe. Their oxygen levels were very low. They also had abdominal symptoms, and we still don't understand why they had that. And so far, as of this year, there's been more than 2,500 cases reported nationwide, and most cases were under 35 years old. At our health system, we had several of these. We had more than 50 to 100 of these in the last couple of years. And we even had to put patients on ventilators for the amount of oxygen that they were being deprived of from the lung injury. I want to show you here what we were seeing and what we still see in patients who developed vaping lung injury. You could see this is a normal lung, where the lungs are nicely inflated, and there's good, you could see that there's air entering into the lungs appropriately. But here, what you're seeing is all this white is inflammation in the lungs that is occurring because of the lung injury from the vaping. And it causes, whenever the lungs are filled with inflammation like that, you can imagine that oxygen is not going to be able to enter the lungs. And these patients had very severely low oxygen levels. And like we said, some of them even went on ventilators. Actually, some of them even had something called ECMO, which is a system while they're on the ventilator to remove the carbon dioxide and to give oxygen to the blood and give the blood back to the body. A very complicated system because of how low their oxygen levels were. This was so we had several news stories from our health system a few years ago regarding these lung injuries. Sorry. I'll go quickly on this slide, but there's many adverse effects of vaping, and this is not just vaping marijuana, this is also vaping nicotine. But it extends from addiction to changes in vision, to the chronic cough and problems with breathing, and even complications with the heart. Going back to marijuana, I wanted to briefly talk about the cardiovascular effects of marijuana. I reviewed the literature. I wasn't as familiar, but I did review the literature in the last 2 weeks. And what I found in the literature is very interesting. And I was not aware about these medical effects of marijuana on the heart. But marijuana can cause a very increased risk of developing heart attacks, what we refer to in the medical field as myocardial infarction. Marijuana use is associated with an increased risk of strokes. Patients who smoke marijuana are more likely to develop an abnormal heart rhythm, such as atrial fibrillation or ventricular tachycardia. And patients who smoke marijuana are more likely to have a rapid heart rate at baseline, what's called tachycardia. Lastly, I'm going to focus on the brain. And I think it's the effects on the brain are always the most pronounced. And the marijuana really affects every part of the brain. And if you look here, this is the front of the brain. This is kind of the middle of the brain. This is the back of the brain. So frontal lobe, parietal lobe, occipital lobe, and temporal lobe. And going in each of these lobes, the frontal lobe, you can develop problems with concentration, the problems with the psychosis, the delusions, the hallucinations. The occipital lobe here, you'll see problems with vision. This is the lobe that controls vision. So the patients have distorted perceptions or an impaired peripheral vision. You can see here the temporal lobe. We talked about the memory changes, the short-term memory loss from smoking marijuana. Down here at the base of the brain, you have the cerebellum and the brainstem. And in the cerebellum is the part of the brain that controls coordination. And patients who smoke marijuana will definitely have a decreased motor coordination, decreased eye-hand coordination, impaired ability to drive a car or drive any vehicle, even walking sometimes. And then the brainstem here controlling some of our reflexes, such as heart rate, blood pressure, and our wakefulness. You'll notice people who smoke marijuana tend to be more sleepy, and this is the effect on the brainstem. So every part of the brain is affected. And I wanted to show you here this slide, effects on the brain from marijuana. And really, every aspect of the brain function is affected. And with long-term use, you can imagine that this becomes more of a chronic issue. So increased appetite, depression, anxiety, memory problems, impaired judgment, delayed reactions. We talked about the psychosis, the withdrawal, the addiction, and of course, the dopamine release, which can stimulate a lot of these delusions and psychosis, etc. I do want to end the talk with one thing that's important. It would be wrong of me to mention all the negatives of marijuana without actually talking about some of the positives of marijuana, which there is very limited use, but there is definitely situations where we use marijuana medically, and in very select situations. This is medical uses of marijuana, not recreational uses. And for us in the medical field, as a lung doctor, for example, the most common reasons for that in which marijuana may actually be helpful is really in the setting of end-stage cancer, and that's really the biggest use for marijuana from a medical perspective. We have a lot of patients who have terminal or end-stage cancers or end-stage lung disease, for example, severe emphysema or whatnot at the end of their life, where we may prescribe them medical marijuana, not in the form of smoking, not in the form of vaping, maybe in edible form, usually in a pill form, or an oil form that they can use so they can improve their appetite, they can gain some weight, it can relieve some of their cancer pain or their difficulty breathing, for example. But these uses of marijuana are what we call the medical uses, like any other drug. This is important to distinguish the medical uses from the recreational uses. Thank you, guys, and I'll stop sharing here, and I'll ask Dr. Hani if we want to take questions at this point.
Thank you very much. This was very informative, and we really appreciate your knowledge and expertise. I think the X-rays that you have shown, normal versus emphysematous, the bully, are really, really striking, at least even to myself. And you wonder how many of our youth who believe that anything legal should be healthy. So how common this emphysematous bully gets exacerbated with marijuana use?
So the bullous emphysema or paraseptal emphysema that we see with marijuana is really in the setting of chronic marijuana use. I'm talking about several years, and it almost looks very similar, but not really exactly like emphysema related to smoking. And we do see that patients who smoke and use marijuana tend to have more severe emphysema than, for example, just smoking or just using marijuana. But we do see this advanced type of emphysema in patients who smoked marijuana heavily for years. It's actually more common than people really understand.
And there was a question that came very similar to what you're just saying. So if you can emphasize again, does vaping is worse for the lung than regular smoking marijuana?
So when we talk about vaping marijuana, I think it's very important to understand that this is something that's very new. So in terms of having medical or data regarding the long-term effects of vaping marijuana on the lungs, we don't have that data yet, but I'm sure we're gonna see in the future that people who vape marijuana for long periods of time will develop lung injury. What was very interesting about vaping when it came out 2 years ago was the severe lung injury, acute lung injury, in a very brief period of time that developed to these individuals who smoked. And looking back, we didn't know exactly what caused it, but now we realize it was probably the oils that's used for the marijuana. And that oil causes an acute lung injury, or sometimes a pneumonia, similar to bacterial pneumonia, but this is a chemical pneumonia in the lungs. It was very severe when we saw it at the time. And a lot of times these people are buying marijuana, the liquid oils, from the black market. It's not really from drugstores or from vape shops, because they're not allowed to sell the marijuana oil. So it was black market marijuana oils causing this lung injury.
Thank you.
Regular vaping of nicotine. Sorry.
I was going to say one last question that came. Are these changes in the lungs that you have shown us are permanent? In other words, if someone listened to Dr. Moore after a while and decided he wants to stop, and of course she will deal with the addiction part, but would their lungs get better with time, or this is a permanent damage?
So yeah, the damage is irreversible. We always say that you can't reverse the changes that occurred, but you can, by stopping smoking marijuana or vaping marijuana, you can prevent further damage to the lungs from occurring in the future.
Yes. Thank you very much. Let's do this because another question that come later. This is the time I would like to introduce Dr. Martina Moore. She is the sort of the star of this show and guest of honor. And I'm very honored to have listened to her and invited her, and she was very humble enough to accept the invite. So Dr. Moore is a business owner, counselor, international speaker, professor, associate minister, and that's just to name a few of her notable achievements. She established the Moore Counseling and Meditation Services over 20 years ago. And She has an outpatient diagnostic center in several places in Ohio, and I'm sure she also would accept telehealth and other things that I'm sure we will ask her later about. She is a professor at John Carroll University and an instructor at the Gestalt Institute of Cleveland. She has traveled to several countries and basically teaching so many psychologists and trainees who now became counselors under her supervision. She is also a co-preacher, if you may, with her husband, who is Reverend Brian Moore, who is a senior pastor in the Ohio area. Moore is not just a professor and a very high, well-trained counselor in the field of addiction and how to resolve it, but she's also a very devout Christian, and that's why we are very happy and honored to welcome Dr. Martina Moore. Dr. Moore, thank you very much for being with us today, and I would leave you to give us your part, and then hopefully you will. Thank you.
Thank you. Well, thank you, Dr. Hanai, for having me. And Dr. Mina, thank you for that wonderful presentation. You did most of my presentation, so thank you for just making the pathway for me. I'm going to share my screen now, and hopefully I'll answer some questions that you already had. So just a little bit about my background. So I am the owner of a substance use disorder center with 4 locations here in the Ohio area. And I've been working with substance use disorders for about 25 years. And I've seen the damages of cannabis use disorders, and I've also seen the benefits of medical marijuana. And so I was glad that Dr. Mina talked about that, because I do want to talk some about the psychological damages I've seen, but also talk about the benefits of medical marijuana. So medical marijuana began in the US in 1996 in California. In 2016, it was legalized here in Ohio, where I am, and 34 current states in the US have legalized marijuana. And more states are expected to pass. I mean, we're dealing with it right now. We are in the middle of election season, and there is many states have legislation on the ballot about legalizing marijuana, and not just in the medical form, but also in the recreational form. So in the US, we know that our states vary regarding our stipulations, and it is up to the states to make the decision of what they want to do. So some of the qualifying diagnoses here for medical marijuana in the US that we see is HIV and AIDS, Alzheimer's, cancer, Crohn's disease, fibromyalgia, chronic pain, PTSD, epilepsy, Tourette's, and colitis. And so there are more, but those are the primary ones we see across state lines. So in Canada, if you're in Canada, in 2001, medical marijuana was legalized, and in 2018, recreational cannabis was legalized. And also in 2018, the Cannabis Act reform, which really helped them to put some boundaries around it when it came to adolescents and children and adults, and also for the sale and the distribution of marijuana in Canada. So the FDA has approved medical marijuana, and the one that I'm most familiar with, and I tell the story about my mother-in-law, who I caretake for, who has multiple myeloma, and she was very ill in her cancer. And I remember sitting down with the doctor, and he explained to us, because she could not gain weight, and she was losing a lot of weight due to the chemo and some of the other reactions and some of the other medications she was on. And he suggested that she go on Dronabinol, which is Marinol. And at first I was a little skeptical, and then I realized, okay, my mother doesn't have a substance use disorder. She never has. And this is a medication that is controlled, that can help her. And actually it really did help to save her life, because before that, she could not keep her weight at a healthy weight, and she continued to end up in the hospital very sick. And so I've been very grateful for medical marijuana, extremely. There is synthetic THC, which is also listed here. There's CBD, and I'll talk a little bit about that. and there are the nasal sprays. But I do need to stay here in the US, the federal government still sees marijuana as a Schedule 1. So it is not approved on the federal level. And that's why each state has their own level. I know there were some questions about the potency of THC and when it comes to vaping and edibles, and especially with the vaping and all of it, when it is given, it can be all the way from 1 milligram to up to 100 milligrams. Vaping is usually in the lower milligrams it's supposed to be, as well as the edibles, but we do see people in the higher milligrams when it comes to the marijuana. So let's talk about marijuana and stress relief, because there's a lot of talk about, okay, marijuana is good for stress. It's good to relieve stress. That's why adolescents take it. That's why they use it. And there was a recent report that came out about this, but I want to just talk about another report that came out in 2002 that talked about more than 50% of adolescents residing in the US experiment with cannabis. And now they're saying that that number is even higher. Researchers report that cannabis served a number of purposes for adolescents, which helped to modify their disturbing emotions. Now, many of us have been adolescents before, and we know hormonally things change. Our brain is still not fully developed. And so when we introduce marijuana, we begin to disrupt the normal progression for adolescents. And so researchers found that 18% of recent high school graduates who use cannabis, they use for coping with stress. And even more, we're seeing it as a result of COVID. Many of the adolescents that we've treated, that we find now as a result of COVID, they say due to the isolation, due to being at home, due to not being able to socialize, that cannabis was really their outlet during the stress, and even the fear of COVID was a big piece for them. So cannabinoid receptors are located throughout the brain, and they're in all of our brain. And what these do is they're a part of our brain development. It can affect, when we use marijuana on these receptors, it can affect our brain development, our memory and cognition, our motivation systems and reward, and I'm going to talk a little bit about that, our appetite, our immunological functioning, our reproduction, our movement coordination, and pain regulation can also be affected. And so when someone is young and they begin to introduce this into their brain, it can affect all of these areas of their brain, and for an adult too. But mind you, the brain is not fully developed in many areas for adolescents or younger children. And so introducing cannabis or marijuana to the brain at that point can really stifle and really do damage to the brain that sometimes can be irreversible. So one of the biggest impacts on young adults is what we see is called the amotivational syndrome. And as I told you, if I go back here, that motivation is really affected when adolescents introduce cannabis to the brain. And so the amotivational syndrome is similar to depression. And as Dr. Mina was saying, sometimes we can't tell when we're diagnosing, when we get an adolescent who is chronically using marijuana and they're depressed, which one we're seeing or which one started which, but we know we have both. So what I do is when I assess and diagnose them, I look to see if I have criteria for both. I have criteria for substance use disorder, mild, moderate, severe, and do I have criteria for a major depression disorder? And within that, I'll treat both of them, but they can look alike. And what that looks like, it can be apathy or emotional bluntness. It can be short-term amnesia, where they're just having problems with remembering things. And so they'll have problems with concentrating in school and having trouble with sometimes with their memory and their inattention. They will isolate. And social isolation is a big part of this. And then just the loss of ambition. Because when a person's motivation is affected, their self-efficacy is affected. And the self-efficacy is someone's belief that, okay, I can complete a task. I can do better. I can complete school. I can achieve. And so when marijuana is introduced there, it really affects that. And their motivation to feel as though they can do better is really affected. So research does show that cannabis is the most commonly attributed cause of amotivational syndrome, which is a psychiatric condition described by changes in their personality, their emotions, and cognitive function. Many parents will say, my child just doesn't seem happy anymore. They don't want to socialize. They isolate. I can't get them to have a conversation with me. Their affect is indifferent. They don't really have a lot to add to conversations. They may have a poor memory, and they just seem disconnected. When at a younger age or before they started introducing marijuana to their brain, they may have been more outgoing, may have socialized more, may have had a much better memory, and their cognitive functioning was just so much better. So many symptoms of amotivational syndrome mirror that, as I said, of depression. And some research shows that the amotivational syndrome affects the frontal lobe of the brain. The frontal lobe of the brain is the part of the brain that's responsible for decision-making, regulating our emotions, decision-making. And in most of us, it's not until our late 20s, and even they're saying even now, early 30s, that the frontal lobe is really developed fully. So marijuana, when it's introduced, can stifle that development of the frontal lobe. And so then that's where we get the short and long-term memory, or the showing of lack of emotions, or the inability to focus on activities that need high concentration. And just like one of the main things I see is that critical thinking, the critical decision-making is really affected as a result. So some of the acute effects we see of someone when they're using or intoxicated, they start out being very euphoric, and then they relax and they get sedated. And then some will have distortions or sensory perceptions and thought and time distortions. And then there's a delayed motor coordination. They'll slow down. Their speech begins to slow down. Their brain, their thinking is slowing down. There's an increased heart rate, decreased blood pressure. And as Dr. Mina talked about, they're at increase of having a heart attack. One of the biggest things we see is hallucinations, paranoia, anxiety, psychosis. And as he talked about, we can see schizophrenia be exacerbated as a result of someone using marijuana. So the memory impairment and excessive vomiting, sometimes even with heavy use, we've seen. In regular users, substance use disorder, in 1 in 16 who regularly use do develop a substance use disorder. And they'll have cravings or tolerance that leads to uses. And what I mean by tolerance is that they can intake more, so their body wants more. We'll see withdrawal symptoms, and there's so much of a misnomer that there are no withdrawal symptoms with cannabis use, and that is not true. We see all the way from problems with appetite, from headaches, problems with concentrating. I've even had some clients that have had some mild physical withdrawals, even from sweating. And so there is some withdrawal from it. Psychiatric symptoms and disorders are in heavy users, especially with a family history of psychosis. So one of the things I do when I'm assessing someone who has developed psychosis and they also use marijuana, I will determine if there's a family history, because there is some research that shows that there's a high correlation from a family history of psychosis and psychosis in adolescents who use marijuana. Dr. Mina talked about bronchitis and the impaired respiratory, and 50 to 90% more car accidents when used also with alcohol. So when it's mixed with alcohol, it's at a greater risk for having car accidents. Higher rates of use of tobacco than other drugs for someone using it. And so those are just some of the effects. We talked a little bit about the e-cigarette or vaping. And this was just a report that said in February of 2020, 2,758 cases reported to the CDC, 64 deaths. And the symptoms, the respiratory illness, as Dr. Mina talked about, GI symptoms, and so forth, were all there. And seen primarily with teens adding THC products to vaping systems. So vaping can be highly dangerous for our teens. I had a parent recently tell me, well, you can't smell it. It doesn't seem like it's as bad as him smoking a blunt or a bong. And I had to explain to them that vaping is just as dangerous in some of the effects. Some of the long-term effects we see is the short-term memory, like I said, impairment that is long-lasting. And I have parents that ask me, well, when they get off of it, will that reverse? And not always. Sometimes it lasts for years or either permanently. There is likely permanent cognitive impairment and loss of IQ in adolescents who begin to use at an early age and continue with heavy use into late adolescence. And poor psychosocial development, because remember, one of the main factors we see is isolation and not socializing. And so the development to socialize has been impaired, which can carry on into adulthood. Impaired educational attainment in adolescents who are regular users, and association, as we talked about, with the respiratory diseases, and higher rates of schizophrenia, anxiety, and the mood disorders. And I just see so much comorbidity with marijuana, schizophrenia, anxiety, and mood disorders. Some of the social effects, it has substantiated that individuals turn to substances for recreational reasons. And we talked about them using it to cope with stress or to reduce aversive internal states. And I will have a lot of young adults, when I talk to them, they said they started using because they were stressed, they were having trouble with socializing, they weren't getting along with their parents, and they found it as a way to help them cope. But it has a number of social and emotional health and legal consequences. And they may be at greater risk for addiction, even more than alcohol. And chronic use may just increase their stress-related motivation. And again, as I talked about, their decision-making and their alterations in their brain and their stress pathways that may exacerbate compulsive drug seeking. And overall, stress coping individuals and harm reduction focus on reducing the amount of ingestion. And so when I'm working with adolescents now, I work with them on harm reduction and say, because many of them are not ready to completely quit. So we'll do some harm reduction efforts and say, okay, well, let's try to do less. Let's not, if you are vaping, let's try to decrease that. If you are smoking a blunt, let's try to decrease the amount of blunts that you smoke a day. And many times what they'll find is they're not able to do it. And so that's when we're able to really zone in and help them to see that they have developed what we consider a substance use disorder. So again, this talks about the developmental effects associated with prenatal cannabis. Our agency has a contract where we work with our Department of Health and Human Services for women who are positive for cannabis when they're either pregnant or if the child is positive for cannabis. And so what we see in the infants is an increased tremor, exaggerated startle, and lower birth weights. We see impaired verbal abstract in their childhood. Their reasoning and short-term memory and attention is impaired, increased impulsivity and hyperactivity, and many of them are diagnosed with ADHD. In adolescents and young adults, increased risk of using marijuana because they were born with it already. And so we see them using it more as an adolescent or a young adult. So there are concerns about it for mothers prenatally of using it as well. So why are we seeing an increase in acceptance of marijuana use? And I really believe there's an assumption, and even with some adults, that it's okay for children and teens. I just had someone tell me recently, oh, I'd rather my child use marijuana than any drug. Matter of fact, I would give it to them if they agreed not to use any other drug. And many parents believe or will see there's no good public health messages. I don't see any billboards or any commercials that talk about not using marijuana. There's overwhelming support for big marijuana industry. We see it because it makes money. And there are financial benefits from taxation. And the cities and the states, they get money from it, billions of dollars from it. And so I do believe that that is why it is so acceptable. There's just so many, there was a research recently and more than 60% of Americans said they support legalizing marijuana for recreational and medical purposes. So some of the challenges that continue is getting the message out that marijuana is not for our pediatric population and not good for adolescents. If you go and you assess most people who have a substance use disorder, they started as an adolescent. As a matter of fact, I don't think I've ever had a client who said they started later than 20 years old. Making marijuana smoking as undesirable as cigarette smoking is what we need to do. I really appreciate the presentation that Mina did, that Dr. Mina did. And I think if we did that more and we educated our populations about this is harmful and there are medical effects, there are consequences, and people are dying from it. Enforcing underage recreational marijuana use for people 21 years or older. And then avoiding similar marketing experiences of big tobacco. And then we really need to counsel parents and teach them about medical marijuana and even, the recreational marijuana, how dangerous it can be for their children. And supporting the need for research on adverse effects, as well as the efficacy of medical marijuana. So I am a proponent for individuals with medical marijuana who have one of those qualifying, especially things like cancer, HIV, full proponent for medical marijuana. But when it comes to recreational marijuana, I'm not a proponent. And I think we need to really look at the adverse effects of that and really support more research. I think there's not enough research out here on it, and I know why that is, but we really do need to engage in more research on medical marijuana. So some of my takeaway messages is there is an accumulating scientific data about the adverse effects of medical marijuana for both fetuses, adolescents, and the brain development, and on mental health disorders. And despite this, there are high rates of use among adolescents and young adults. And the perception that marijuana use is harmful is at an all-time low, that people believe that it's harmful. The US states with legalized recreational use have higher rates of use by teens than young adults. And the challenge of the pediatrician is to counter arguments that marijuana is benign and that the benefits of legalization outweigh the risk to society. I think we really need to come against that message, and we need to begin to speak out and really help people to see that no, marijuana is not the answer. It's not benign, it's not harmful, and there is harm. Now, I just want to say there is help. And the best way to get help is to have a child get in a full assessment, a full what we call a biopsychosocial assessment. And during that, we would assess them to determine if there is a substance use disorder and if there's a behavioral health disorder as well. There is treatment. It can be on an outpatient basis or residential treatment. It just depends on what the assessment yields. Sometimes a person just may need some support sessions. Sometimes they need individual counseling. Sometimes they need group counseling. And sometimes people really do need a residential setting. So it really just depends on where the person is in their need. All right, I'm going to stop my screen now for any questions or comments.
That was great. There are a few questions that came, and I'll try to read them for you, and please feel free to expand. My daughter, who is 16, occasionally have a party with the rest of the girls, and in more than one occasion, I understood from her that they are trying marijuana for fun. When do I worry about making this, that this could become a habit?
You should worry now. None of us know how, when, or how we will develop the disease of addiction. And addiction is a disease. No matter if it's alcohol, cocaine, opiates, it's a disease. And so the best way to mitigate the disease is to stop it before it develops or gets worse. So it should be stopped now.
Great, thank you. Very clear and no hedging. My twins are 17. They have bad friends and they smoke and occasionally drink, but only one of the two is doing well in school. Not sure if I should blame the habit or not, since his brother is okay. And what should I do?
Yeah, so addiction plays out differently in each person's brain and personality. I would take him to see a counselor and get an assessment and determine if the marijuana is affecting his functioning, because it may be. So I would take him to some counseling to figure that out.
Okay. Third question, My son is definitely addicted. We tried several times to stop it, but he relapses within 1 to 2 months. How can we reach you for assistance?
I can give you my email address, or Dr. Hannah, should I just give my phone number or should I give my email? I can give my email address. I can put that in the chat box. How about that?
We actually go ahead and put in the chat box and we will put it under your name. We already have put your website many times while you were speaking.
Great.
Put your phone number as well. Do you accept telehealth, like in a way people who can call you and sort of contract with you through the phone, or you have to physically see you?
No, I do telehealth as well, but I'm only licensed for the state of Ohio and for individuals in Ohio, but you can reach out to me and I can help to connect you with someone in your state.
Okay. All right. Now, I know that needs hospitalization. What are the criteria for this mom to know?
I'm sorry, I apologize. You broke up. I didn't hear all of that.
Sorry, that's probably my internet.
That's okay.
The mom was asking, how can I differentiate between the need for my son to get an sort of a in-house or hospitalization compared to an outpatient counselor?
Oh, so the assessment will determine that. So the first step, if you're concerned that your child may have a disorder as a result of their substance use disorder, you take them in to get an assessment. The assessor will recommend a level of care based on the findings of the assessment. So they may say outpatient, inpatient, residential. They will determine what that level of care is based on the assessment.
Okay. The next question is actually maybe for both you and Dr. Mina, if he can help us. Saying my dad unfortunately suffers from, and I'm sorry if I pronounce it wrong, it's not my field, it's called one type of dementia. And she said it's a Lewy body dementia. And the daughter thinks that the use of cannabis sometimes help in his circadian rhythms. She is a bit guilty though. She is worried that this is maybe upsetting God if she uses it. Personally, I work in cancer, but I don't know what effect of that to help or hurt dementia. Does any one of you know?
I'm not familiar with that for dementia. I do know that there have been some trials on medical marijuana for dementia and other forms of Alzheimer's and so forth. Maybe Dr. Mina may know a little bit more about that.
Yeah, I'm not familiar with that. The one thing about, you said it was Lewy body dementia?
Yeah.
Lewy body dementia is associated with delusions and psychosis. And so you have to be a little bit worried about using marijuana from if it's not medically prescribed. But if it's medically prescribed and recommended by the doctors who are taking care and managing the dementia, and it's helping his circadian rhythm and keeping him functioning and eating, because part of dementia is not eating and losing weight. And if it's medically appropriate, there's no reason to feel guilty about it if it's helping.
Absolutely.
I think it's very appropriate to go in.
Good. And since we brought the idea of feeling guilty and feeling that as if you sinned against God, spiritual, religious aspects, if you can, on that, I mean, feeling that I'm sinning. What do you think?
So I'll speak to that when it comes to medical marijuana. I do not believe, I believe that God has given us the wisdom of medicine, to utilize medicine in the appropriate way, and not to abuse medications, which is very different. And so I am in favor of science. I'm in favor of the medical benefits. And I think sometimes as Christians, we are not as aware that the sciences is a God-given gift, and we see the miracles of medication every day. And when I see the miracles, even in the treatment procedures that I do, I thank God that he gave us the wisdom and foresight to be able to utilize them to help people get better. And so I think that there is some myths out and there is some untruths out to keep us from accessing medicine. And so I try to help people to see that it's a gift from God. And I think it's important for us to pray and ask God to lead us to the right medical professionals that are led by God.
Dr. Nina, any comments on this question?
Yeah, I completely agree with you, Dr. Moore. I think when a medication, any medication that we give, we're prescribing based on the science that God gave us the mind and the talents to be able to understand benefits versus harms and be able to identify that appropriately and prescribe that or recommend that. I do believe that using it in that context is, we shouldn't feel guilty because, you know, I've seen so many end-stage lung cancer, end-stage emphysema or COPD patients that don't have any appetite, that are losing weight or that are unable to eat, and medical marijuana has helped them when used in the right context and the right way as prescribed by the medical literature.
Mm-hmm.
Okay, question to you, Dr. Moore. I know many states had legalized marijuana. What exactly legalization means for me as a mom to a minor, and do I have the right as a parent to prevent him from ingesting?
Okay. Yeah. So some states have legalized medical marijuana, and many of them have that, but not recreational. Not everyone has legalized recreational marijuana, I should say. You do need to be at least 18 years of older. In most of those states, that is what you're supposed to be. So yes, a parent can intervene. So it's not like a 16-year-old should be able to walk into a dispensary in many states. Although I do know there are some states where it does happen. I need to say that. So as a parent, it would still be against the law in many states for your child to be able to go in and purchase marijuana, even if it is legal. It's supposed to be 18 years of older. There is some push to raise that age to 21. I don't know if that's going to happen, but there is some push in some states to raise it to 21.
The next question is for both of you. Does edible marijuana is more or less dangerous to psychology or to my body? So you go ahead.
Yeah, I personally think it's just as dangerous. Again, it depends on the milligrams and how much they're getting. But the reason why I think it's more dangerous is because people don't realize how harmful it is. So they will take more of it. They'll ingest more of it. They'll use more of it. And they see it as less harmful because it is in the edible form. So I've seen people with some horrible reactions to edibles as well. Most recently, I had a client who was very psychotic because he was ingesting so many edibles. And so he had actually, what we had said, had over ingested. And so, yes, it can be very dangerous. I don't know, Dr. Mina, you want to add anything to that?
Yeah, I mean, I think from a pulmonary standpoint, it's probably not as harmful, obviously, as smoking or vaping. But I think from a psychological, from a cognitive, psychiatric perspective, I do think that the effects are the same. In fact, one of the things that in my reading, oral edibles, it takes longer to enter into the bloodstream, but the peak effects of marijuana can be even higher. And that's the peak effect in the blood. And that blood is going to go to the brain and affect the brain in the same, even maybe more harmful than regular smoking marijuana.
Thank you. Are the effects on the brain permanent? I mean, after how long they are irreversible? I understood from Dr. Macarius that the effects on the lung are permanent, but I only start smoking for 6 months. Can you also comment on my future lung functions? You go ahead first, Dr. Martina Moore.
Yeah, I'll start out with saying for what we call chronic marijuana users, people who have used, we usually consider someone chronic if they're using more than 2 years plus, that they are really chronic at that point. We do see some of the effects psychologically as irreversible. We will see the Motivational Syndrome, we'll see the problems with the memory. And so we tell people the sooner, if it's only been 6 months, it's good to get off of it now. to try to stop some of the reversing. And it also depends on your age. If you are younger and you're still using, remember the frontal lobe of what I talked about, you're affecting that. And so you really want to stop affecting that now so that you don't have permanent damage or increased damage from using.
Romina?
Yeah, just to comment on the irreversibility in the lungs, 6 months is not a long time of using marijuana. So the amount of lung damage from using, even if you're using marijuana daily multiple times in 6 months, is unlikely to cause significant lung injury. I'm talking here about years. But the biggest problem, and like Dr. Moore was alluding to, is the addiction and the tolerance and the ability to quit becomes much harder every day that you smoke or vape marijuana. And so, you know, this is more of a chronic issue, but we always recommend the sooner you can stop, the better you can for your future in terms of your brain, your lungs, etc.
Thank you. There is a question, I think, from an adult. Does cannabis use reduces my sexual potency?
So it's interesting that that's asked, because in my research and what I found in my readings and my studies is I found there's two. So some people say, oh, it enhances, it makes it much better, more vibrant, especially women, it's shown that. And so really they're saying more of the reports are saying that it does really increase their sexual intimacy. Now, there's also another body that says, yeah, but is that because of the euphoric effects that you're feeling from the marijuana that's happening? Or is it really that over a long term, when you're not using, when you're not intoxicated from marijuana, do you still have those same effects?
Okay, and I'm not sure if it's the same person, but he or she is saying, can sexual assaults increase or decrease under the influence of this smoke? I mean, if my daughter is in a group and they are all smoking, should I worry about her being assaulted sexually?
Well, all I can say on that is there's always a risk of that, especially when someone's intoxicated on any drug, to be assaulted, because we are impaired. And so there's always a risk for that. Do I know? I won't say that I've seen or heard of that happening a lot, and maybe it's just has not been reported like alcohol, but I'm sure it has happened and it can happen. And so I would just be cautious of that.
Okay. Nina, there is a question that says, my son is taking marijuana once a week with his friends. Personally, as a dad, I have no problems with that, but he is coughing more. Do you think is that because of marijuana, or it could be anything else?
I mean, it definitely could be from marijuana. Marijuana use chronically is associated with a chronic cough, even if there's no associated lung inflammation. If you know, I don't know the history of the young person, but you know, if there's a history of asthma and you smoke marijuana, the asthma can get worse. The marijuana smoke itself can cause irritation in the airways and can cause a chronic cough. So definitely, I would think that there may be an association between the marijuana smoking and the cough.
And along the same vein, Dr. Moore brought the topic that things are these additive or synergistic on the lung injury that you have shown us, or each one is separate?
Can you repeat the first part of the question?
Yeah, so Dr. Moore was saying that a lot of people who smoke marijuana, sometimes they do other substances. How are these, are they additive or synergistic or not?
Yeah, I mean, definitely we think there's synergy between marijuana and tobacco smoke in terms of causing emphysema, for example, or chronic lung disease, what we call chronic obstructive pulmonary disease, and likely also contributing to lung cancer. Going back a second about the assault question that came about, you know, a daughter in a group. One of the things about marijuana, and one of the things we always learn about, is it's the gateway drug. So if there's a group that's using marijuana, I would not be surprised to hear that there's other drugs involved if marijuana is in the picture, and that can in itself lead to other problems or assault or whatnot. And Dr. Moore, I don't know if you agree or if that's something that you've seen as well.
No, I absolutely agree with that. Thank you for bringing that point up. It's very rare that they're just using marijuana. They probably have alcohol or something else along with that. So yes, thanks for bringing that up.
I want to thank you both and the organizers for an excellent session. Dr. Moore, I hope you don't mind if we reach out to your office for consultation. So
Yes, please do.
yeah, Dr. Moore and Dr. Mina, can you both almost address, I want you to address by two messages, one to the parents and one to the young youth. What would you end your message with? What would you like them to take a message with?
So I'll start with the youth, and I will just say that I do get it that I'm sorry, is there a background noise? Are we hearing that? Okay. Okay. I do understand that there are some positive effects that you feel as a result of using marijuana. And I also want you to know that there are some long-term negative effects that can outweigh what you're feeling positively now. And we just want you to be aware of that, and that there are other resources and other ways that you can deal with the stress. You can deal with the isolation. You can deal with feeling some of the emotional feelings that you're feeling, rather than ending up with a long-term addiction. And it is addictive. What I'll say to the parents is to talk to your children and not overly preach to them, not overly smother them, but really speak to them and give them a platform where they can talk and share and be honest, and then allow them to be a part of the connection of help if they need help. So rather than just showing up at a counselor, talking to them about that and helping them to be a part of that process and giving them privacy if they will engage in that process. That's just extremely important for them to be able to accept it, because many adolescents feel as though, I don't want to go talk to anybody because they're just going to tell my parents everything, or my parents are going to come in and want to know everything. So just trust that you're taking them to a professional that's going to make sure that if there's anything or if they're at risk of harming themselves or another, that they will let you know, but give them the freedom to get the help that they need without you being so overly involved. And remember, marijuana is harmful. Thank you.
Well said. Thank you. Dr. Mina?
I love what Dr. Moore just mentioned and said, and I think one of the most important things that we can do with our children, in our families, in the church community, is to not be judgmental. And I think for those who are using marijuana, I can't tell you how much, no one will judge you, and everyone will just want to help and support and encourage, and never take it upon yourself to treat yourself if you're in a state where you're unable to come off of a habit or a toxic addiction that's unable to recover from. There's a lot of support around us that you can use to help recover from this. So I love what Dr. Moore just said.
Thank you very much. Dr. Mina had just had his second baby, so I can hear it. Congratulations.
Sorry about that. Yeah.
No, please. That's the loveliest sound.
Yes, it is.
I want to end with the verse that I started with. St. Paul wrote in 1 Corinthians 10:23, and I'm using the NIV here. I have the right to do anything, but not everything is beneficial. I have the right to do anything, but not everything is constructive. And I think that's the most eloquent verse that can really describe the session we are in. Yes, the country, the world, the states could legalize something. That doesn't mean we, as the sons and daughters of God, need to follow that route and say amen. If it is not constructive, it's not beneficial, and as you heard, it's very addictive, doesn't mean because it's legal, it is moral. I would like to really thank Dr. Martina Moore, international speaker, trainer, professor, associate minister, and a business owner of Moore Counseling and Mediation Services. Dr. Moore, as you have heard, has very long experience as an addiction specialist, and she will be happy to help those who may need help, whether parents or children. Also, I'm very indebted and thankful to Dr. Mina Makarios for his expertise as a lung specialist, critical care specialist, and assistant professor of Hofstra University. Thank you both for an amazing session. And if we were to get any questions, I'll send them to your emails. And I would love if you can send back the questions, and the answers, we'll send them back to the session. Hope to have you in another time again. Thank you.
CYC Christian Youth Channel.